You gave were all voluntary, not the government telling the people what to do. I volunteered.
Well, he would respond that you and the Democrats say that that you can buy the public plan or you can decline the public plan. Of course, they don't say the congressmen have to buy the public plan, which means it might not be that great an option. Okay, yes, ma'am. Yes, sir. Who's next?
My name is Richard Gross, and I live in your district. I am a card holder of Medicare. I was a Korean vet, and I fought for this country. I know what I pay every month for this card. It comes right out of my Social Security check. I don't have a choice. They tell me what I'm going to pay, and that's it. My question is, through all of these 3 or 4 or 5 feet of this plan, where has Congresswoman Pelosi, and I'm being courteous, Congressman Waxman, Senator Dodd, where are all of these people telling me how much, when this no longer is in my pocket, what am I going to have to pay for this current insurance that they're trying to slam down on me? What is the cost for me as an individual going to be every month? I know what I pay here. And further statement is, Mr. Obama, keep your hands off of my card.
I don't know the answer to what that card's going to cost you after this program goes into effect. I believe they are going to change Medicare, at least by doing away with Medicare Advantage. And you can read the other parts of the bill that affect seniors, including there was a discussion earlier about you're now going to get free counseling, which you can already get on end-of-life services. But what the cost will be, I don't know, and I suspect they don't know.
I have sold health insurance for the last 20 years. And the last 5 years, health savings accounts exclusively, so it looks like I'm out of a job. But I came up with my own solution, and instead of all this, to the program. I call it the Phoenix Project. This is doable now, it's very inexpensive, covers all pre-existing conditions, and you won't believe how cheap it is. I'd give this to John here, to look at his leisure. There you go. I call him John because we're kind of like in the same age bracket, I guess. Now, everything I've heard today, and I'm amazed that I've never heard this discussed. He talked about premiums. They should all be tax deductible on the 1040 for everybody. But no one has mentioned co-pays, co-insurance, deductibles, doctor visits, eyewear, dental. All these items should be tax deductible on the 1040 that you don't have now. That would save the guy who go to a hospital now and costs $3,000 co-pays. That is after tax dollars. You may have to earn $5,000 to pay the $3,000. I don't think that's pretty cool. So I'd like to recommend or ask the question: can these items, according to the health savings account, eligible expenses, be put on the 1040 for everybody to use?
The answer is not under this Congress. Oh, I'm sorry. Yes, ma'am. We're going to try to go quickly because we got about 12 minutes left and at least 12 people.
Can you hear me?
Yes.
Thank you.
Keep it brief.
Yes. I'm a child psychologist, and I'm also a mother of a child, an adolescent with autism. I'm a child psychologist. I'm a child psychologist and a mother of a daughter, a teenager with autism. And I wanted to talk to you about mental health parity and possibly about discriminatory practices that insurance companies are doing against mental health providers and consumers. And I just wanted to talk with you and get your promise, I hope, or your commitment to at least look at this complex issue.
I'd be happy to look at the complex issue. Mental health parity is an issue that gets debated in Congress a lot. There is, I think, a societal bias when it comes to mental health care treatment. One of the problems I don't like is mandates, government mandating things. I think there is an education process. I think we ought to encourage people to demand mental health parity when they buy a policy. But I think we've talked about, I've tried to talk over and over again about right now, the decision of whether or not the policy you have covers mental health services isn't your decision. It's a decision made by your employer, and that's the thing I'd like to change. Yes, ma'am.
Hi.
Hi.
Thank you for being here.
You bet.
I'm a mom, and I'd like to talk also about our children and about the federal government putting in place vaccinations where they're not telling us the ingredients.
Yes.
This new swine flu vaccination they're doing the trials on, the H1N1, and they're not telling us that in the trials they're not going to put in the squalene, which is the same ingredient that was put in the Amtrak's vaccination for our poor Gulf War veterans, and they all developed inflammation diseases. This squalene is going to be in the vaccination when we are told to roll up our sleeves. Also, our federal government has made it so that we cannot hold accountable the pharmaceutical companies, the vaccine companies. They are not going to be held liable. We cannot sue them, nor can we sue anyone who engages in the vaccination process.
I appreciate the concern. I'm aware of the issue. What I'd like to do is, I want to thank, in the back of the room are Ashley and Bethany. Ashley and Bethany, will you raise your hands? And Joan. Heidi, please raise your hand. Would you please take that specific question to them, because I'd like to get you a written response, because it could be that there's legislation that either will be drafted and introduced by some member of Congress to deal with whether or not you're required to take those drugs, or what's in them, or disclosure of what's in them, and I need to be better informed about it. So if you would talk to either Ashley or Bethany or Joan and lay that out for them, then and give them your contact information. Let me look at what bills are there, and perhaps I can get involved. We're out of time. We're down to 12 minutes, so please talk to them. Yes, sir.
Thank you, Congressman, for coming. My main question is, how does your bill or Representative Ryan's bill address tort reform?
Tort reform.
Ask that question.
All of the Republican bills embrace the concept of tort reform. Mr. Ryan may have put a tort reform provision in his bill, and the Republican Study Committee bill has a tort reform provision in it. Every Republican proposal embraces tort reform, because I think all Republicans believe that the tort reform, or the vast majority of Republicans believe the tort reform, the tort system is a big factor in the cost of health care. It is not only driving up cost because doctors pay phenomenally high malpractice insurance, but also because they practice defensive medicine. You go talk to a trial lawyer and they'll tell you that that's not true. My bill was not written as a comprehensive, to use a word that's been used, as a comprehensive bill including tort reform. It would be paired with somebody else's tort reform bill. What I want to do is my bill is focused on really two words: patient choice. My bill is driven behind the idea of putting you in the driver's seat behind your own health care. So there is not, I did not include a separate tort reform provision, but this is not the bill that I would enact as the entire comprehensive plan. I would couple it with other tort reform provisions that have been introduced in the past, including I offered an amendment in committee for loser pays on tort reform many years ago. I've tried several times, just not been able to get it through. Yes, sir.
Thank you for being here. I have a question that I thought would come up. We all know who signed the Declaration of Independence. Their names on the bottom.
Yep.
Who wrote this atrocity? Who is responsible? I would like to, and other people who would like to know the names of the people that wrote this.
That's a fair question. Let me make some comments. Number one, I don't know who wrote it. Number two, you do need to know that often on legislation, the chairman of a committee will involve the ranking member of the committee, and they will, typically the chairman of a committee will draft a bill, then they'll ask the ranking member, meaning the minority member, for input. They might not take much of the input, but they'll at least ask. In this case, at least on the House side, the chairman of our committee, Mr. Waxman, never, ever, ever, ever once, to my knowledge, invited Mr. Barton, Joe Barton of Texas, my ranking committee member, or Nathan Deal, ranking member on the health subcommittee on which I also served, into the room, or even gave them a copy to comment on or to make any changes to. It just didn't happen. There was no bipartisanship. There was not only no bipartisanship in the House bill, by and large, the protest you saw by Blue Dogs